Heart failure. Epidemiology, pathophysiology, diagnosis, treatment, management, and care. What is heart failure? Okay, we'll see that one in the slide ahead. In the diagrams here, you can see normal heart, anatomy, and a failing heart anatomy. Now, a failing heart, you will learn that at this point, at the far end, we have a weakened muscle which cannot pump enough blood. While on the other side, we have a heart muscle pump which pump blood normally. Okay, heart failure, we have the right-sided heart failure and the left-sided heart failure. And defining heart failure, it's a condition in which heart doesn't pump blood as it should. That is heart failure. This normally happens due to several factors which precipitate the failing of the heart. First, we have right-sided failure. In the right-sided failure, we have symptoms such as fatigue, increased peripheral venous pressure, we have ascites, have enlarged liver and spleens. May be secondary to chronic pulmonary problems. We have distended jugular veins, anorexia, complaints of GI distress, weight gain, and dependent edema. Left-sided heart failure signs and symptoms. We have dyspnea, unexplained cough, pulmonary crackles, low oxygen saturation, third heart sound, reduced urine output, altered digestion, dizziness and lightheadedness, confusion, restlessness, anxiety, and fatigue. We have pathophysiology of heart failure. Heart failure occurs when your heart muscles doesn't pump blood as well as they should, just as I had said earlier. This can be due to muscle weakening, symptoms such as hypertension, coronary artery disease, which leaves the heart stiff or weak, thus impeding the efficiency of heart. Symptoms: shortness of breath, that is dyspnea, when you lie down or exert yourself, fatigue and weakness, peripheral edema, swelling, arrhythmias, reduced ability to exercise. Treatment and management: have control and prevention. Not all heart failure presbytants can be reversed, but treatment can improve the signs and symptoms. One way to prevent heart failure is to control conditions that precipitate heart failure, such as coronary artery disease, high blood pressure, diabetes, or obesity. You can have exercise lifestyle changes, which include exercise. In exercise, you can have cardiovascular exercises, such as deep breaths. You can have meditations. Then you can reduce sodium intake, whereby you will get foods which are less in sodium, because as you know, sodium will contribute to electrolyte imbalance, and if there is much fluid, that is much electrolyte in the blood, that will mean increased peripheral vascular resistance, thus increasing high blood pressure. This high blood pressure may inconvenience the functionality of the cardiac muscles, which in turn may lead to heart failure. How managing stress? As you know, what happens with stress? When somebody is stressed, there is a part of the brain that that triggers the production of cortisol hormone. This cortisol hormone increases high blood pressure as it acts in conjunction with the adrenal medulla or the kidney, adrenal glands. When there is an increase in blood pressure, the very thing that we said of reduced sodium intake will happen to it. That is, will have increased high blood pressure, and that will corrupt the integrity of the heart muscles. If the integrity of the heart muscles will have been corrupted, then it means that blood supply, that is pumping of the blood, will be corrupted too. Then you have losing weight. This is very true. It may sound funny, When you speak of losing weight, you speak of things like if you find somebody's obese, it means that he has high rates of having less functionality, less exercise. And another thing, the larger the surface area of the body, that gives the heart a difficult work to function. Another thing will have much weight. We can relate it to high cholesterol level, which may also increase atheros- atherosclerosis. Atherosclerosis may lead to stiffening of the veins, that leading to thinning. When the surface area of the veins is thinned, it means that pressure is increased. If pressure is increased, then we have high blood pressure, which also affects the integrity of the heart muscles. You can see in that diagram the man complaining of chest pain. We learn that the man has fluid filled in the lungs, that is edema. Now that we call pulmonary edema, which leads to dyspnea. And we can also have peripheral edema where your legs swell. You can have them in your hands, that is upper extremities. It can also happen in your stomach. You can have a swollen belly. Treatment. Yeah, heart failure can be managed, but can also be treated. It's only that the main challenge here is that some conditions cannot be completely eradicated, but can be managed. And in that case, we can use several drugs coupled with exercise, lifestyle changes where we have exercise, reduce sodium intake, and we have reducing the weight, the aerobic exercises, and any other. Angiotensin converting enzyme inhibitors. We have calcium channel blockers, beta blockers, and diuretics, ABCD. These are very useful in managing heart failure. When we give diuretics, the key thing that we are focusing on is reducing the fluid retention. When we give beta blockers, we are working on decreasing muscle, as in decreasing the resistance, decreasing cardiac output, therefore lowering the high blood pressure. And we give calcium channel blockers, we are focusing on relaxation of the vessels, therefore decrease peripheral vascular resistance, which may contribute toward control or stabilization of high blood pressure. Then we have angiotensin converting enzyme, that is angiotensin 2 converting enzyme. Angiotensin is known very well of causing contraction of the blood vessels, which in turn leads to increased high blood pressure. This angiotensin converting enzyme is also important in treatment of diabetes type 2. Mechanism of action of angiotensin converting enzyme inhibitors. We have example of the drugs. We have enalapril, we have captopril and lisinopril. Mechanism of action: relaxes blood vessels, lowers blood pressure, prevent diabetes, related kind relate, related and kidney damage. Beta blockers: slow heart rate, decreased blood pressure. When taken in eye form reduces eye pressure. We have under beta blockers, we have two classes. We have selective and non-selective. Selective, we have atenolol and metoprolol, which decrease cardiac output. Non-selective, we have labetalol and carvedilol, among others. These act by decreasing renin, angiotensin 2, and aldosterone. On the other hand, they also decrease cardiac output and peripheral vascular resistance. We have vasodilators, which is calcium channel blockers and organic nitrates. Calcium channel blockers, as we saw earlier, we have example of calcium channel blockers. We can speak of carvedilol, labetalol, and when you get to organic nitrates can speak of minoxidil, you can speak of nitroglyceride. All these help in relaxation, and that is dilation of the vessels, which leads to decrease in blood pressure. That is, they widen blood vessels, thus decreasing peripheral vasoresistance. We get to diuretics. Diuretics, we have thiazide diuretics, potassium-sparing diuretics, and loop diuretics. Under thiazide diuretics, example drugs, we have hydrochlorothiazide, clothalidone, clothiazide, indapamide, metolazone. Potassium-sparing diuretics, we have spironolactone, that is, trade name is aldactone. We have amiloride, we have triamterene, that is trade name derenium. We have eplerenone, that is sold in the market by the name Inspra. Loop diuretics, we have Lasix, that is furosemide. Then we can also get to use dopamine hydrochloride, that is for a specialist in managing heart failure. You know how dopamine works. Dopamine causes mood stabilization, which may cause a balance or may strike a balance between the levels of the hydrocortisol hormone. Increased urine excretion to get rid of excess salt ions, that is what diuretics does. And if you have carvedilol, it comes in tablets, that is 6.2 milligram, 6.25, sorry. We have 12.5 milligram spironolactone tablet, which comes in 25 milligram, digoxin tablet, which comes 62.5 microgram, 250 microgram, or we have the oral liquid, which comes at 50 microgram per milliliter. Hydrochlorothiazide tablet comes at 25 milligrams. We have furosemide tablet, which comes at 40 milligram. Injection comes at 10 milligram per milliliter, that is 2 milliliter ampoule, and the oral liquid comes at 20 milligram per 5 milliliters.
A healthy heart, as seen here, beats
You
approximately
can
60 to
see
100 times a
the
minute, providing
physiology and
oxygen-rich blood to the
pathophysiology
rest of
of
the
heart
body.
failure from
The
this
lower
video.
left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster, and the ventricle may increase in size, becoming an even less effective pump. When the kidneys sense the reduced blood flow, they attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak heart. The progressive effect of the heart failing to properly circulate blood and congestion due to fluid retention is known as congestive heart failure.
Thank you for watching. Till next time, it's Joflix. Welcome.